Three of the world's biggest AI companies just backed something almost nobody noticed. Stripe, Anthropic, and OpenAI are now funding an effort to stop respiratory infections. Not a new chatbot or image generator, they're trying to prevent people from getting seriously ill. And it might be the most important thing they've ever done. Here's the shocking part. Respiratory infections kill about 4 million people every year. That's more than COVID-19 at its peak. More than flu and pneumonia combined. And we treat them almost exactly like we did 50 years ago. Antibiotics, antivirals, rest, hope. The system works, but only after you're already desperately sick. But imagine if an AI could spot the warning signs before you felt anything. Imagine a system that predicted who's about to get a serious respiratory infection and alerted them before symptoms even started. That's what these companies are building. Stripe's handling the financial infrastructure. Anthropic engineered the core AI. OpenAI's contributing research. This isn't vague corporate speak. It's real money, real engineers, real commitment. The wild part is what this reveals about where technology is actually heading. For years, we've heard endless promises about AI transforming healthcare. It's mostly stayed hype. But now actual companies with serious technical chops are stepping up and putting real money on the table. And here's where it gets interesting, what that means for your health, your privacy, and how we think about medicine entirely. To understand why these three companies care, you need to understand what each one actually does. Stripe isn't an AI company, they're a financial infrastructure company. They've processed trillions of dollars globally. When a health initiative needs to move money fast, or when patients need to access treatment, Stripe makes it work. Anthropic is different. They're a leading AI research company that built Claude, one of the most advanced AI systems in the world. When you need machine learning to spot patterns in medical data, to predict disease, to analyze patient information at scale, that's Anthropic's expertise. They know how to build reliable AI that handles complex real-world problems. OpenAI built ChatGPT and has deep expertise in training massive models and deploying AI at scale. They also have significant research resources. So here's what happened. Someone realized that combining Stripe's financial infrastructure, Anthropic's advanced AI, and OpenAI's research capability could actually solve a problem that's killed millions for centuries. Not separate solutions, one coordinated effort where each company does what it does best. That kind of collaboration is rare in tech. It signals this isn't just another healthcare startup pitch. Someone understood that beating respiratory infections requires more than just good intentions. It requires real infrastructure, real AI capability, and real scientific expertise all working together. The fact that these three companies decided to align suggests they've seen the research and they believe this is actually possible. The technology is fascinating. Instead of waiting for someone to get sick, AI learns to spot early warning signs. Maybe it's subtle changes in breathing. Maybe it's biomarkers in blood that doctors would normally miss. Maybe it's voice changes that precede illness by days. The AI trains on thousands of cases where we know exactly how infections started. It learns what invisible warning signs look like. Once trained, it can analyze a healthy person and say, this person has a 75% chance of developing a serious respiratory infection within 3 weeks. That changes everything, because now doctors don't wait for symptoms. They start preventative treatment. They monitor closely. They catch the infection early when it's easiest to treat. The AI needs 3 things: good data, good models, and good deployment. Anthropic handles the models and data science. OpenAI contributes research. Stripe makes sure the system actually reaches patients, paying for treatment, coordinating with hospitals, moving money globally. In theory, this could prevent the majority of serious respiratory infections from becoming serious. That's potentially 4 million lives saved annually. But the real breakthrough is proving that AI can move beyond predictions into actual prevention. Once you prove this works for one disease, you can apply it to every other disease. Cancer, heart disease, diabetes, every condition that kills millions could be caught early. This is why these companies care. This is why they are putting money behind it. They're not just fighting respiratory infections. They are building the future of medicine itself. Imagine Sarah, a 52-year-old with mild asthma, generally healthy but her lungs are sensitive. Right now, she waits until she feels sick to see a doctor. She might end up hospitalized with pneumonia. With this system, she'd share health data weekly through a wearable or phone app. The AI constantly analyzes her breathing, her voice, her activity, and sleep. One Tuesday, the AI flags her. Your respiratory infection risk jumped to 70%. Not maybe a strong signal. She gets an alert, sees her doctor, starts treatment before infection becomes serious. She stays at work. She stays healthy. Multiply that across millions. In countries where healthcare is limited and respiratory infections are a leading death cause, an AI system works even with minimal infrastructure. Just a phone, just voice data or basic readings. Doctors can prioritize who needs urgent help. Hospitals change too. Right now they treat infections reactively. You get sick, you come in, they treat you. But if they can predict which patients will develop serious infections, they monitor closely and intervene early. Oxygen, medication, careful watching before things get critical. The ripple effects spread fast. Fewer hospitalizations, fewer deaths, lower healthcare costs, fewer people missing work, fewer grieving families. That's what these companies are trying to build, not just better medicine, but better lives. And here's the part that matters. This works right now. Here's what makes this different from medicine today. Traditional healthcare is reactive. You feel sick, you call a doctor, get diagnosed, get treated. You're always behind the disease. Preventative healthcare stops disease before it starts. Vaccines, exercise, healthy eating. That works for some things, but it's generic. Everyone gets the same advice. Some follow it, some don't, and none of it's personal to your actual risk. This is predictive medicine. Artificial intelligence says, based on your unique biology, your genetics, your habits, your environment, here's your specific risk for this disease today. Then it acts before disease becomes serious. The difference is enormous. Instead of generic health advice for everyone, doctors tell you your respiratory infection risk is high. Take these precautions. Watch for these symptoms. We'll monitor you. That's targeted. That's personal. That's preventative. That actually works. Compared to reactive healthcare, it saves lives and money. Compared to generic prevention, it's actionable. Compared to other AI health projects, this one has 3 heavyweight companies coordinating, real funding, and a concrete target. The scope is revolutionary too. Most health tech focuses on wealthy countries, but respiratory infections hit developing nations hardest. Stripe's infrastructure means this reaches countries without existing healthcare systems. A patient in Nigeria with a phone and an internet connection gets the same AI analysis as someone in New York. That's the real breakthrough. It's not just smarter medicine, it's medicine that works for everyone, everywhere, regardless of where they live or how much money they have. So what does this mean? On the surface, it means fewer people die from respiratory infections. That's huge, 4 million lives annually. But implications go way deeper. First, this proves AI can move beyond prediction into actual prevention. For years, people said AI would transform medicine. Now a major company is actually putting that into practice at scale. If this works, you can do the same for every other disease. Cancer, heart disease, diabetes, all preventable instead of treatable. Second, it reshapes healthcare entirely. Right now, healthcare is crisis management. You get sick, you get treated, hopefully you recover. What if medicine became about catching problems before they happen? The entire structure changes. Hospitals become monitoring centers. Insurance changes. The economics transform. Third, this raises huge questions about privacy and AI. To predict disease, the system needs data. Personal health data, breathing patterns, voice, genetic information. Who owns that? Who accesses it? What if the AI makes mistakes and flags someone as sick when they are healthy? These aren't small questions. They shape how AI integrates into society. Fourth, this signals a change in tech power. For a decade, big tech focused on making you click ads. Now the biggest companies are solving civilization-scale problems. That's bigger than it sounds. And here's where it gets serious. This is happening now, not in 5 years, not in some theoretical future. The technology exists. The companies are funded. The only question is whether it actually works at scale. So what happens next? And what should you watch for? Here's how this plays out. First, there will be trials. Real hospitals, real patients, real data. The AI must prove it works in practice, not just on old data. Real-world trials separate hype from reality. Second, regulation questions emerge. If an AI system recommends treating someone for an infection that hasn't happened yet, that's a huge liability. Governments must figure out what's allowed. That's slow and complicated but necessary. Third, watch data management. The system needs enormous amounts of health data. Where from, who controls it? Stripe's job includes managing data ethically. If they fail, the entire initiative collapses. Fourth, look for international rollouts. If trials succeed in wealthy countries, the real test is developing nations. Nigeria, India, Bangladesh, places where respiratory infections kill the most people but healthcare is minimal. That's where the real impact happens. For you personally, watch your healthcare system. If hospitals in your region start offering AI-powered predictive monitoring for respiratory infections, that's the system working. If you get an alert that your infection risk is elevated, take it seriously. But here's what's really worth watching. Will this work? Prediction is easy. Preventing disease at scale is hard. There will be failures. There will be mistakes. Some people will get false alarms. Some will slip through. The question is whether the system works well enough overall to save more lives than it costs. That answer matters for everything that comes next. Here's what to take away from all this. 3 of the world's biggest tech companies just bet billions that artificial intelligence can prevent disease instead of just treating it. They're not making a new app. They're not building a gadget. They're trying to reshape how medicine works entirely. If they are right, this is the beginning of a massive change. Imagine a world where serious illness becomes rare because doctors catch it before it starts. Where artificial intelligence isn't making you scroll social media endlessly, but instead is saving your life and your family's lives. Where healthcare becomes prevention instead of crisis management. But they have to prove it works. They have to show that their AI systems are accurate, ethical, and actually save lives. They have to deploy at scale across the developing world where the need is greatest. They have to earn trust from governments, hospitals, and patients. What matters for you? This is the future of medicine arriving now, not in fantasy or hype, in real trials with real companies putting real money down. This is what happens when tech companies stop building consumer gadgets and start solving the problems that actually matter. Watch what happens next. Watch the trials. Watch the rollouts. Watch whether this initiative reaches the places where respiratory infections kill the most people. Because if Stripe, Anthropic, and OpenAI pull this off, it won't just save millions of lives. It'll prove that artificial intelligence can solve humanity's biggest problems. That's worth paying attention to. Follow for daily AI news.